This conference will now be recorded.
Hello, good afternoon, and welcome to part 2 of the Brain Recovery Project's very first town hall. My name is Monica Jones. I'm the visionary founder and executive director of the Brain Recovery Project, and I'm here today with Audrey Vernick, who is our director of patient and family advocacy.
Hello.
Welcome. Hi. So in part 1, we talked about health transition in the overall child-centered objective, improving the transition to adult life. And Audrey, can you kind of introduce to our audience here what we're doing about item 2, which would be education transition?
Sure. So my role is to help the child who's had epilepsy surgery across the lifespan, and we really started thinking about what happens after they graduate from high school and that next step in the process. And it's complicated and it's unwieldy. There's a lot to it. And I'm going through it myself with my own son. So I'm very much aware of how challenging it is. So we decided to create this guide, which ended up being 120 pages long. And then a course just to really walk you step by step through each area and lay out everything you need to be thinking about in terms of transition. So,
right.
Yeah, and we created basically an advocacy university transition course to make it more than just a webinar or something you read, but something you can really live in, for as long as you need to at your own pace.
Right. I think the webinars are great for, topics that you can digest really easily, but for me, IEPs, transition IEPs, this really complicated material seemed like something that we should do in a different way, which would be teaching you through multiple webinars and guides and downloadable content, more like a course. Actually, it is a course. Yes. Versus just a guide that you download or a quick 45-minute webinar you watch, because it's far more complicated than that, wouldn't you think?
It is very much so. And I think it's easy to look at these checklists about transition that are like 10 things and you're like, oh yeah, I got this. This isn't so hard. But the reality is when you actually start doing some of the steps and recognize really the problems with the way the system is set up to support families through transition, which basically is that there isn't really a system, then you realize there's really a lot to know, and knowing it, you can't act on it appropriately if you don't know the information. So that's the idea, is we lay it all out for you, all the things you need to think about. We don't necessarily have the answers, and I just want to say that I'm not going to be able to tell you, for example, how do you find the best day program for my child, or how do I get on a housing list, because every state is different. But the idea is we'll walk you through each step so you at least know where to look and what questions to start asking and how to start the process.
And you went beyond education transition, which is really something specific to kids who are IEPs, but it kind of started to grow and grow and grow, and we covered other things like health and financial planning, right?
So what happened was we wanted to use the law as the law around transition in the IEP as the basis for the guide, which we did. And as part of that, we started to cover healthcare transition, because that's actually something that can be reasonably addressed under an IEP. It isn't generally done well, but it could be. And then we started thinking about, well, what about healthcare after you graduate? What does that look like? How do you transition to adult care? And then we started thinking about future planning, like when should you really start thinking about this, and how do you make the plan for the rest of your child's life from now until after you pass away and your child might still be living, all the steps. And then, really looking at, what happens, that where are they going to live? What financial resources do they need to access? And then we're going to continue our work and do more research-based resources for you, looking at college transition to college, looking at body safety and sexuality, all of these other topics that will just continue to address such an important topic to really be thinking about and talking about, really starting at quite a young age. So yeah, it ballooned into something much bigger than just transition in the IEP, because a child's life doesn't end at 22, right? It's really just starting, and this is just the kickoff, right? The IEP should launch your child into a good place, so that on the last day the bus, drops them off and pulls away, the next day should be set up for them for what the rest of their life will look like. So we guide you to get to that point, but then what? We also need to be thinking really long-term down the road as well.
I think it's important to understand that so many of these things that we talk about, like health transition, how am I going to transition my child to an adult healthcare provider, a lot of that we can start to address it in the IEP. You can have goals around asking the appropriate medications, asking the appropriate questions for a doctor, managing medication, understanding how to titrate, understanding body awareness, sexual safety, all these other things that really you have to think about when you're transitioning into adulthood. Again, can be addressed in the IEP, but also it did balloon into something even bigger, which again is really rich and dense, and we felt like it would be better in a course.
Yes.
So go ahead.
I'll just add that if your child's not on an IEP, there's still a wealth of resources here, because while I talk about what could be an IEP goal, let's say your child's homeschooled or in a private school, there's no reason the family or even community resource agencies couldn't be working on these goals with the child at transition age in those high school years, even if the child's not on an IEP. So there's still a lot of information there, even if your child is not in a public school and on an IEP.
Right. It's great for anyone really who's thinking about that transition step into adulthood.
Yeah.
You also have been doing quite a bit of regular blog posting for us. Can you talk a little bit about what you've covered there for us?
Sure. So, again, as I've been immersed in this transition world, both for Brain Recovery Project and for my own child, there's all these aha moments. I feel like every week I learn something that I didn't know before. And I've honestly been doing a deep dive into this for the past several years. So I'm sort of surprised there's anything I still don't know. Even last week, I learned that, for example, in California, regional centers give housing tours 3 times a year, which my caseworker didn't tell me about, and in my research I hadn't uncovered that. So we decided, as these things pop up, it's hard to put them, we can't keep revising the guide and the course every week. So I'll just be giving regular updated blog posts of information and things to be thinking about. During the pandemic, we've been concerned a lot about what happens to these kids that are transitioning. So I created a series of blog posts on how to look at education, employment, and independent living skills while locked down at home. Like, are there resources your child could be accessing right now online? What activities could you be doing with them? That sort of thing. One of the things that I learned about this year was emergency planning, the importance of emergency planning, and that goes beyond a seizure plan. It's really looking at what were to happen in any setting. So we think about the school setting a lot and what's in the IEP, but I'm thinking, I've got my future thinking goggles on, right? I'm really trying to visualize what's happening in the next setting. So does my son understand what to do if he's living in a dorm or in a transition living program or in a group home and there's a fire or an earthquake? And does he have the skills to express to a roommate what he needs to do or say, or what his emergency plan is? So I created a blog post kind of around emergency planning that would include a seizure action plan, and other planning could be implemented in a school setting during high school, but also could be taken with them to the next adult setting. What else have I written about? Can you help me remember?
I think it's important for everyone to, check on Facebook. We post them about once a week is when we share this information. We'll also link it in an email, or just go to our website, scroll down the first page, and you'll see just about all of the blog posts there. You can search our website by whatever topic you want. But again, we can't keep revising that guide all the time, or every single page on our website all the time, especially as these really narrow questions come up, and you're doing such a great job of addressing them in the weekly blog posts. I know also the topic of body safety and sexuality has come up a lot in various social media groups. And what we've decided to do is collaborate with an organization to provide, we're not quite sure yet exactly what we're going to do, whether it's going to be a series of webinars for our parents about body safety and sexuality for their children. One thing that's important to remember is that there really is a very broad spectrum of outcomes in our community, whether you're talking about the conditions that cause these seizures to be drug resistant, whether you're talking about the outcomes after even a specific type of epilepsy surgery. It really all depends on so many different factors. Both Audrey and I have children who've had hemispherectomy at relatively young ages, and my son is very different from her son. Yeah. But we both have issues and questions about body safety and sexuality for our children, just like just about every other parent in our community. So we're working pretty hard with an organization to try to get some training up. I don't know if it will also be online training for the teens in our community or for the young adults. So again, check back regularly so that you're apprised of, you know, where it is that we're going to go with that. But that's an important topic, is really making sure our kids are safe in adulthood. Okay, well, that's what we're doing in terms of the transition to adult life. Let's move on to the next impact objective, which would be improving the quality of life of the whole family. It's not just the child with epilepsy who's had epilepsy surgery that we serve, but it's also the family at the end of the day, because it's the family who supports that child. And we have three kind of narrow initiatives around family quality of life. The first would be managing that parenting stress. We've all been there. We know that these are very scary journeys many of us are on, whether you're just starting to explore surgery as a treatment for your child, whether you're coming to terms with the challenges your child may or may not be having, whether you're in a rough spot because maybe perhaps the expectations of surgery weren't what you really thought were going to happen, or what the outcome isn't what you thought were going to happen. So we have already up on our website 3 wonderful webinars around the toll of caregiving to help you manage kind of that day-to-day stress that you're going through if you're having caregiving challenges. And then we have a new peer support program that we're going to talk about, but we'll talk about that in part 3 here. We do family conferences every 2 years for the entire family. And again, it's not just for the parents, where we do very rich seminars for them, but we have wonderful childcare for the kids. We have had outings last year for the teens and young adults in our community, and those went so well that we decided what would be a good idea too is to do some sibling workshops and sibling outings. We know that the siblings have challenges too. I know my son, he's 11, my second son, he's 11, and he goes through some rough times when people may be staring at us when we're walking through the Target. Maybe my son, the older son, typically uses a wheelchair, and my other son is starting to kind of struggle with managing his feelings about his brother, his feelings about how others perceive his brother. Another parent reached out to me pretty recently and said, my daughters are having a rough time with how our daughter who had epilepsy surgery is doing. And so in 2022, for that family conference, we had to postpone this year because of COVID. We're going to try to develop some rich webinars, or not webinars, some rich sessions for them, and perhaps some outings where they can start to share their feelings and connect with others. Audrey, why don't you talk about the peer support that we're starting to do at the Brain Recovery Project?
Sure, this is really exciting. We are launching our peer support program, and right now we're training our first cohort of peer supporters. We're working with a national organization called Parent to Parent USA, which provides quality emotional support for families of individuals with disabilities or special health care needs. And we really want to make sure that our peer supporters are well trained with, research-based, evidence-based best practices, so that the information that is being provided to families that are seeking that peer support is really based, grounded in that evidence-based best practice. And yeah, I mean, we know we have the Facebook groups, and we all love chatting and supporting one another through those resources, but we just want to make sure that we have, for the peer supporters we provide, that they're really trained in these, how to respond to a parent's query, how to provide advice about whether or not to do surgery, how to guide, for resources that a parent might be looking at for a young adult that's transitioning, every conversation and question that might come up, and we want to just do that in the best possible way.
Yeah, I think it's important to note, our peer supporters are not going to provide advice as to whether or not a parent should have surgery or have the child have surgery. We are arming them with the evidence-based research of how to help the parents navigate the journey, meeting them where they are, and guiding them in terms of making sure they're at a level 4 epilepsy surgery facility, making sure that you recognize sort of what stage of the parents of children with disabilities go through these phases. A lot of people think it's that grief, the 5 stages of grief. Actually, it's not. We go through what's called the an adaptation cycle. And so meeting the parents where they are in terms of that adaptation cycle is what our peer supporters are being trained on. And also, you know, how to have empathy, how to get down in the hole with them, how to guide them in the right direction versus just, you know, you don't want a peer supporter who's just talking about themselves, who's just talking about their child, their journey. We want to make sure our peer supporters are matched with similar etiologies, similar conditions, similar surgeries, similar outcomes. Some of the surgeons we work with sometimes will say to me, I'm not sure I want to refer some of my parents to you because our son's had a rough journey, and rougher than most, and I may not be the right peer supporter for a parent because that journey is very different than, let's say, a child who's just having a laser ablation. This is very exciting for us. I really think so far the training has been excellent. It's not a 1-hour training. Our peer supporters are going through hours and hours of training to make sure that they're doing this right. And then let's talk.
Sorry, I'd like to add too that there also there's a an overview epilepsy training that was a 4-hour training that was provided to us by Dr. Kyriakopoulos at Dartmouth Hitchcock Epilepsy Center, and they're one of the managing epilepsy well centers. That was a 4-hour training that was really robust, and you know, it's an overview of how to, you know, what epilepsy is. It seems sort of basic in a way, but then it also goes into all of these other factors that impact epilepsy. They also really look at epilepsy across the lifespan and have programs that are about managing epilepsy in adulthood. A lot of members of our community will go on to continue to have epilepsy, right? So not everyone is, you know, cured by surgery. And so how do we manage epilepsy well? That's a really important piece. And then our peer supporters will also have a training, an overview training on the different types of epilepsy surgery and devices. And then those peer supporters that want to go on to be education navigators will receive another level of training around the IDEA and the IEP process and that sort of thing. So it is quite extensive, and we were so grateful for the dedication of these peer supporters. And we have so far 4 languages represented and 9 states and Canada. So we'll have, you know, we have a pretty broad wealth of knowledge, resources, language, et cetera. And I think it's going to be a great program. We're just starting. We haven't even launched yet. We're hoping, I don't know, when are we officially going to launch, Monica?
Summer. We're hoping summer. Yep, we're hoping summer.
Great.
Yeah. And then the last thing we're doing in terms of peer support is collaborating with a group. They're called abilityonline.org, and they have listservs for young adults who have disabilities, teens who have disabilities. What's different about these listservs is that they're moderated by trained persons who can be on the lookout for example, is the teen having depression that's arising to the level of perhaps they're making some comments about suicide, or are they making comments that indicate that the parent needs to really be notified of something, or is the young adult seeking some sort of help that somebody can say, here's the resource for you here, in providing them again with some evidence-based information. We think the Facebook groups are great for a lot of this stuff, but some people need some more guidance and supervision. Our teen groups, for example, parents can be allowed if the child uses an assistive communication device to communicate. We're not excluding anyone, but it's done in a safe environment with trained people who are moderating the groups. And that's something that will also launch in the summer. It'll be embedded on our website, and you can go in and, very similar to a social media platform, engage with other young adults with disabilities similar to your child's, and same for the teens. And that's what we're doing in terms of peer support.
And then can I add one thing about office hours?
Oh yes, we don't have that, but yes.
Yeah, so we just launched office hours a few weeks ago, and initially the focus was going to be on education, but you know, again, we're really looking at the patient experience across the lifespan. And so my office hours are going to change to be power hour, and we'll be addressing any topic that families want to talk about. So, and even if you're going through the course, our transition course, and you have questions and you want to jump on, you know, in a small group setting and chat about what your questions are, any question you might have. And then hopefully once the peer support program is up and running, we'll have a monthly support hour for our community members to jump on a Zoom call and kind of share ideas, questions, you know, seek resources, whatever might be needed there as well.
That's going to be exciting too. Thanks, Audrey.
Mm-hmm.
So this is the end of Town Hall Part 2. Town Hall Part 3 will be in the next couple of days, probably in about a week, where I'm going to go through all of the research that we've conducted in the past and some exciting research that we have planned in the next year or two. Thank you for joining us.
Thank you.